DNeuro stands for two things. One is diabetic neuropathy, which is our first indication, and the other one is discovery of neuroregenerative therapies. And both are absolutely needed and a huge clinical unmet need in the world today. So we do have a vision and a mission to be the first regenerative therapy in the space. As you may all know today, or some of you may know, diabetes is a pretty widespread issue globally, and today we treat the pain only. We give gabapentins, pregabalins, and if that doesn't treat the pain and the patient is still complaining of pain, then we give them treatment to stop the pain in the central nervous system in the brain. And that's usually via SSRIs and tricyclic AMPs. And these are not great drugs. They are for psychiatric conditions and have quite a few poor outcomes, unfortunately. The impact on quality of life in diabetic neuropathy is if you do advance to diabetic neuropathy, you have almost a 5x chance of developing ulcers, and then a 3 times chance of actual amputations as a result of the ulcers. And of course, the quality of life measures as listed. We do have great GLP drugs in managing weight and decreasing hemoglobin A1C these days, but they do not cure diabetes. So we expect this to be in the rise for quite a few years, unfortunately, until a cure is in place. Today, we're looking at about 500 million people with diabetes, and about 50% of them do experience diabetic neuropathy, and that's just going to continue to be a clinical unmet need. The way we're addressing this at DNeuro Biosciences is a 3-compound approach. So there are 3 different drugs. In reversing the pathology that has happened over many decades or many years of diabetes, the high concentrations of glucose in the circulation and that oxidative stress impact the microvasculature, thus impacting the peripheral nerves. And we utilize our DNeuro 1 compound actually restores mitochondrial function, so at the cellular level. DNeuro 2 is about activation of repair pathways and reduction of neuroinflammation. And then DNeuro 3 is all about angiogenesis and repairing that microvasculature. So we do not regenerate nerve directly. We provide for the optimal environment for nerve to regenerate. And you know that nerve does regenerate, but very, very slowly, if you remember the old Christopher Reeves or the original Superman story. Now, since we have 3 different compounds, 3 different drugs, they're all delivered subcutaneously for treatment, we've also invented our own delivery system that can house and contain different compounds and align them appropriately for the patient to take themselves and be very adherent as well as safe. They're pre-dosed, pre-filled cartridges, disposable, and they would have about a month's worth in the delivery system, and this is our own IP. We are not at the discovery stage of the compounds. The compounds have existed in the research world and the scientific community for quite a few years. We are the inventors of the protocol, and our claim is the indication, which has never been done in this combination and with our treatment protocol. To date, we have, I think we're on patient number 17, if this is slightly outdated, but we have about 6 months of data on outcomes in treating patients with diabetic neuropathy. If you are familiar with diabetic neuropathy, you'll know that the first-line diagnostic is a monofilament test when a patient complains of pain or loss of sensation in their hands and feet. So you take a monofilament to various points on the hands and feet, and you ask them, how do you feel? Do you feel full sensation, moderate, pins and needles, and so on? And here's an actual subject in the study, in our pilot study, where at baseline we evaluate about 270 plus points on the hands and the feet. This is just the palm side of the right hand. They have quite a few points where they feel nothing, some points where they have mild sensation, and other points where they claim to have full sensation. But remember, that's a bit subjective. On follow-up, we do a monthly follow-up on these patients after treatment is initiated. They show more uniform distribution of mild sensation, and on week 8, for this patient specifically, they have full recovery. On the right-hand side of the screen is a graph, or 2 graphs, that we test vasomotor and pseudomotor function. It's electrodes that they put their hands and feet on, applies a little bit of electrical stimulation, and waits for the sweat glands to respond. And as you can see, even those are also improved in the course of time. At baseline, they're quite asymmetrical and abnormal in response. And then on the follow-up, they're almost to normal level and less asymmetrical. So the vasomotor side starts to improve slower, but is tracking along with the sensory side. So we're monitoring in a dual pathway to make sure that nerve is actually coming back to normal function. I don't need to talk about the market size. If you know about diabetes and half of the diabetics go into diabetic neuropathy, it's a large market. This is our clinical pathway. Again, DNeuro is part of a larger conglomerate and a portfolio of companies under Bugatti Holdings. So all of our clinical trials, regulatory pathway, everything is done under one house, so we actually control that overall. But we expect to be in the US in 2031, outside of the US in 2029, commercially launched. The financial projections are quite large. Again, so I won't go into that too much. We'd be happy to have a discussion with anyone that has questions after the talk. And today we're raising a seed fund because we believe we're at that stage where we would like to generate more data for the FDA and get to a breakthrough or accelerated designation by the FDA, and that would give us a much better priced round, a Series A. Some of the team members, our partner here, Dr. Yahya is also here. The rest, Dr. Omar is actually the inventor. We are co-inventors and co-founders ourselves. And then we've got an excellent extended team beyond that. Happy to answer any questions, any comments, concerns, and we have a little tiny booth outside in the hall for all of you to stop and visit. Thank you.